For over 25 years, care teams have relied on Masimo's SET measure-through motion and low-perfusion pulse oximetry to deliver accurate SpO2 readings, even in challenging conditions where other pulse oximeters fail. Visit Masimo.com/SET to discover why SET remains at the heart of patient safety.
Hi, this is Evan Karish, Editor-in-Chief of Anesthesiology, and I'm here with some highlights from the November 2021 issue, as selected by the journal editors. This month's podcast will explore new information about the superiority of ephedrine versus phenylephrine for cerebral macro and microcirculation. We'll also look at the big picture behind the yearly crush of surgical cases each December. We'll discuss two studies focused on issues in our youngest patients, one on hypoxemia risk and another on cortical complexity during general anesthesia. And then we'll close this month by highlighting a review of the ASA physical status in honor of its 80th anniversary. The review authors celebrate this enduring tool and examine its ongoing value for clinicians, researchers, and regulators in the future. Let's begin this month with a clinical study that compares the influence of ephedrine versus phenylephrine on the cerebral macrocirculation and the microcirculation. We know that both ephedrine and phenylephrine are often used during surgery to manage systemic blood pressure. However, little's known about the influence of these vasopressors on the cerebral circulation and oxygenation, and the optimal choice of vasopressor during neurosurgery has really not been defined. Brain oxygenation depends on both the macrocirculation, which is cerebral blood flow, and on the microcirculation, which is blood flow through brain capillaries and the primary site of oxygen exchange. The comparative effects of ephedrine and phenylephrine on the brain microcirculation are not well understood. Cerebral macrocirculation and microcirculation can be measured by cerebral blood flow and capillary transit time heterogeneity using magnetic resonance imaging. Dr. Klaus Koch of Aarhus University in Denmark and colleagues conducted a prospective randomized double-blind trial to compare these two vasopressors in brain tumor patients. The patients received either ephedrine or phenylephrine, and MRI was performed before and during vasopressor infusion. The study found that ephedrine improved cerebral blood flow and tissue oxygenation compared to phenylephrine at similar mean arterial pressures. The primary endpoint of capillary transit time heterogeneity increased significantly with phenylephrine use and decreased significantly with ephedrine. Although the study was limited by the small sample size of only 20 patients, the authors did conclude that the data support the superiority of ephedrine and raises some concerns about phenylephrine. An accompanying editorial by Drs. Paul Garcia and Charles Brown focused on this article. The editorial emphasized the need to control intraoperative hypotension and stated that the study findings offer guidance for anesthesiologists when choosing pharmacologic treatments. The editorial added that MRI is not practical for real-time decision-making, but its use in the study emphasizes the need for better ways to monitor cerebral perfusion. Check out the article for free in this month's issue. Next, we have another clinical study. It examined the cortical hemodynamic signal power changes in ongoing nociception in both healthy, awake volunteers and surgical patients under general anesthesia. We know that general anesthesia causes unresponsiveness and amnesia, but we do not know the extent of nociception or analgesia during anesthesia. Surgical patients could be vulnerable to nociceptive barrage, and this in turn could lead to inflammation and hyperalgesia, central sensitization, and chronic pain. We know that nociception can be detected by neurophysiologic monitoring of low-frequency hemodynamic oscillations in brain cortex. Dr. Ki Ping of Boston Children's Hospital and colleagues tested the hypothesis that nociception to heat or to surgical trauma would reduce the power of low-frequency hemodynamic oscillations in brain cortex. The authors evaluated a group of 15 healthy, awake males who underwent ongoing noxious and innocuous heat stimulus to the back of their hands. They also evaluated 13 patients who received general anesthesia while undergoing knee surgery. During functional near-infrared spectroscopy, the authors found a reduction in the total fractional power in the healthy volunteers during ongoing noxious stimuli and in the surgical patients during invasive procedures. More specifically, they saw a decrease in the slow 5 frequency band of oxygenated hemoglobin concentration changes of the frontopolar cortex. However, this reduction was partially reversed in surgical patients who had received a regional nerve block. According to the article authors, the findings show that ongoing nociceptive processing is associated with power changes in slow-wave cortical hemodynamic oscillations. In addition, the findings may foster development of a surrogate signal that could be used to better assess nociception in patients under general anesthesia. This article is available for free in this month's issue. Let's continue our focus on the brain, but now in children. Our next study is a prospective cross-sectional evaluation of changes in cortical complexity during general anesthesia. Cortical complexity, or the differentiation of neural activity in the cerebral cortex, changes in adults in various ways in response to different general anesthetics. However, changes in cortical complexity in children during general anesthesia have not been well studied. Dr. Michael Puglia led a team, including the anesthesiology and neuroscience departments at the University of Michigan, in a study using a specific mathematical algorithm to assess cortical complexity in children. Their study population included 50 children and teens aged 8 to 16 years who underwent surgery with general anesthesia. Data were recorded using a 16-channel electroencephalogram. Based on their algorithm, the authors found that cortical complexity increased with age and is consistent with a maturing brain network. Overall, general anesthesia was associated with a significant decrease in cortical complexity compared with baseline measures. Their algorithm also identified decreases in cortical complexity during the maintenance phase in anesthetic state transitions. The study found that during recovery, the spatiotemporal measure of complexity decreased compared to baseline after controlling for spectral changes. The article authors concluded that their results add to the literature on cortical complexity and how it may be affected by both age and anesthetic state transitions. Our next study is a retrospective analysis of prescription opioid use after shoulder surgery with and without a peripheral nerve block. Opioid use remains common after ambulatory surgery, including shoulder surgery. Perioperative interventions to reduce post-surgery pain and associated opioid use are needed. Peripheral nerve blocks have a clinical, meaningful effect on postoperative pain, but the data show that they're used in only about half of elective shoulder surgery patients. Researchers led by Dr. Gavin Hamilton of the University of Ottawa in Canada conducted a retrospective, population-based cohort study using the records of approximately 48,000 adults who underwent elective shoulder surgery at one of 118 Ontario hospitals. Between July 2012 and December 2017,